I call this meeting of the Public Health and Safety Committee, to order. Today is Tuesday, September the 12th, 2020. Well, I can't talk today. Today is September the 16th, 2025. We have one person sign up for public comment, Mr. Steve Ryder. If you could make your way to the front.
Am I on?
Mr. Ryder, you're recognized.
Could you let the public know what I'm speaking on?
Mr. Ryder is speaking on BL 2025-1011. Thank you.
Thank you. In opposition, yes. Thank you so much, members of the council and everybody here. Today, I'm talking about the two lease agreements, specifically the one related to Commerce Center Park. There's really, I think, an important omission in the file. Metro Code of Laws 2.24.225, appraisal report required for the Metropolitan Council approval. And I'll read it verbatim. It says, for transactions involving sale, lease, sublease, or other disposition of real property which require approval of the Metropolitan Council, authorizing legislation may not be considered by the council in the absence of an appraisal report that includes, without restriction, the following components. And the first one listed, A, current value. There is no current value in this file. That property is worth millions and millions of dollars. All we have from Colliers International Valuation Advisory Services is a market rent analysis. That's all they have there. And you know what their comparables are? Fair Park, Fort Negley. Those are still uses for sports. This is going to be used for a private enterprise. That's totally different. Totally different. You cannot do your due diligence. You cannot do an analysis without having a land value appraisal. Thank you so much.
Thank you, Mr. Ryder. All right, I have a proposed consent agenda that includes every item but number 2, 5, and 6 at the moment. I'm going to read through everything. If you need anything removed from consent, just please raise your hand once we get going. Item number 1, RS 2025-1477, a resolution appropriating a total of $200,000 from the Juvenile Court of Nashville and Davidson County to various nonprofit organizations selected to receive community fund partnership grants. Sponsors Toom, Huffman, and Welsh. Item number 3, 2025-1487, sponsors Toom, Huffman, and Welsh. Resolution accepting a grant from the Tennessee Department of Health to the Metropolitan government acting by and through the Metropolitan Board of Health to provide an array of programs and direct patient care services to meet the public health needs of Tennessee citizens. Item number 4, RS 2025-1488, sponsors Toombs, Huffman, Welsh, and Allen, a resolution approving a grant contract by and between the Metropolitan government acting by and through the Metropolitan Board of Health and the Tennessee Justice Center for the provision of assistance and support to individuals enrolling in public benefit programs for health insurance and food assistance. Item number 7, RS 2025-1491, sponsors Toombs, Huffman, and Welsh, a resolution approving amendments 10, 11, 12 to a community health workers for public health response and resilient grant from the Centers of Disease Control and Prevention to the Metropolitan government acting by and through the Metropolitan Board of Health to address COVID-19 health disparities in the Nashville area. Item number 8, RS 2025-1493, sponsors Toombs and Huffman, resolution approving an application for hazardous materials emergency preparedness grant from the Tennessee Emergency Management Agency to the Metropolitan Government acting by and through the Office of Emergency Management to expand awareness of emerging trends and deliver the latest and most pertinent training to personnel. Item number 9, a resolution accepting a grant from the Nashville Police and Public Safety Alliance to the Metropolitan Government acting by and through the Metropolitan Nashville Police Department to fund the testing of sexual assault test kits by an outside laboratory or laboratories to improve effectiveness in evidence processing through appropriate outsourcing. Sponsors Toombs, Huffman, Welsh, and Allen. Item number 10, BL 2025-1003, sponsors Toombs, Huffman, Hill, and Vo. This is an ordinance to amend section 10.60-020 of the Metropolitan Code to transfer the administration related to the regulation of burglar and fire alarm systems from the Department of Codes Administration to the Nashville Fire Department. Item number 11, BL 2025-1004, sponsors Huffman, Hill, Allen, and Vo, an ordinance to amend Chapter 10.64 of the Metropolitan Code to adopt the 2024 editions of both the International Fire Code and the NFPA 101 Life Safety Code to adopt the amendments contained therein. And I did mention that item number 12 is on consent, but it is not. So I just wanted to make that clarification. Does anyone have anything that's on the consent agenda that you would like removed? Okay, I'll entertain a motion to approve the consent agenda. Okay, all those in favor, aye. Opposed, no. Consent agenda passes. We'll move on to item number 2, RS 2025-1480, a resolution authorizing the Metropolitan Government to join the state of Tennessee and other local governments in amending the Tennessee State Subdivision Opioid Abatement Agreement and approving the related settlements and agreements. Thank you. Any discussion on this item? Yep. Councilmember Evans, you are recognized.
Thank you, Mr. Chair. I wanted to follow up on a question that came up yesterday in Budget Committee. Councilmember Allen had asked about basically what are we going to use the settlement money for? And Ms. Zach, who was here representing the health department, said, oh, we're going to put it out to bid like we've done other things. And we've only done one pilot project that went out to an RFP. So I wanted some clarification from health about what the intention is, because the opioid settlement steering committee, the last time to my knowledge that they met was in public way was July 2023.
Do we have a member of the Department of Health? Please recognize yourself. Thank you.
Hi, Kristen Zach from the Metro Public Health Department. We have prepared a second RFP to go out that's being reviewed by procurement now, and it would be open to the majority of the abatement strategies. Providers would be able to bid on it based on the approved abatement strategies that the state has outlined. So that hasn't been released yet, so we can't say what it will be funding, but it will be pretty open and flexible.
Thank you. And thanks for that clarification. And so kind of tying into that, I think, I got, of course, a chance to see you at the Behavioral Health Wellness Advisory Council meeting where the discussion about the original pilot, was shared, with the group. And so is that information going to be shared publicly? Because I think one of the challenges is we don't really know how we're spending opioid money other than if you've been following the process kind of along the way.
The slides that were presented during that meeting, will it be shared publicly? I don't know why it couldn't be, but I can make that request. Yeah.
Okay. I mean, if it could be shared with the chair through Margaret Darby, that would be awesome, I think, because it was very favorable to what the settlement committee had originally kind of scoped out, and then the results I thought were really positive. So I would appreciate that, and thank you very much.
Thank you, Councilmember Evans. Any other discussion on this item? We have a motion to approve. All those in favor say aye. All those opposed, no. Motion passes. Next item on the agenda, item number 5, RS 2025-1489, sponsors Toombs, Huffman, Welsh, and Allen. Resolution approving a grant contract between the Metropolitan government acting by and through the Metropolitan Board of Health and the Mental Health Cooperative for the provision of emergency psychiatric care for individuals in crisis at the Mental Health Crisis Treatment Center and staff to support the Metropolitan Nashville Police Department co-response model known as Nashville Partners in Care and the Nashville Fire Department co-response model known as Nashville Responders Engaged and Committed to Help. Do I have a motion? Thank you. I had just a couple of questions. If we could have someone from either Mental Health Co-op, MNPD, I'm not sure who is exactly here, just about the use of this program, and then I'll open it up for other questions. And recognize yourself, sir.
Sure. Chris Gilder, the Metro Police Department.
And thank you for attending today. I just think this is a really good program that's provided an excellent abundance of resources to individuals who just could have ended up in much different situations in other cities and scenarios. So I would just like for you to just give an overview of this specific use of money, how that's going to expand the program and what that's going to touch.
Sure. Well, I don't know if the health department is here, so I'm not sure how they've allocated the funds. If you don't mind, I'll speak a little bit to how we've utilized it thus far up to this point. You're right. It's been a phenomenal model. It's something that other cities have reached out to us and asked, how the details of how we work it out because they've wanted to bring it to their cities. Since its inception, Partners in Care's responded over 58,000 calls for service. So the way they work is there's an officer that rides with a clinician. They go to, obviously if there's a call involving someone who is in a mental health crisis, they'll respond to that. But they're also responding to other calls. So they've been to over 11,000 exclusively calls involving someone in a mental health crisis. And as a result of that, only a little over 4% of those calls have resulted in arrest. And unfortunately, a lot of times when you have a call where someone is in a mental health crisis, they're doing things that could otherwise be criminal in nature, but they work to divert them away from the criminal justice system and try to get them the help that they need. And they've been phenomenally successful in that. In addition, these funds not only support staffing the clinician in the car with the officer, they support training. And we have trained to date over 600 officers and supervisors in the 40-hour CIT training. So even if you're not one of these specific cars, the vast majority of the officers out here on the street have had that CIT training in the event that they respond to a call where someone's in crisis.
And Deputy Chief Gilder, last night in Budget and Finance, you cited a particular statistic that I found jaw-dropping regarding the number of arrests. I don't know if you could share that again. Yeah,
it was 4.4%. Since its inception, only 4.4% of the crisis calls have resulted in an arrest.
Thank you. Councilmember Gadd, you're recognized, and then I'll get to you, Vice Chair.
Thank you so much, Chairman. Thank you for being here and for presenting this. The question I have, first of all, thank you for the work that's being done. One of the best practices I've learned through a community responder cohort over the last several months, also really it sits at who's getting assigned at the emergency, at the 911 calls. Mm-hmm. So how is that getting assigned currently? If someone calls with a crisis at a, situation, how is that getting determined whether or not, or how does it get determined of whether or not mental health is going, the police, if you could respond to that?
Sure. So, well, the DEC has dispatch criteria. We work with the DEC on, these are the type of calls for service that the co-response cars will respond to. So if one of those is 10-8 in service, and they meet that criteria that the DEC has, then they will send that car. Obviously, sometimes we end up at calls where it becomes evident later on that this person is someone who's in a mental health crisis. It wasn't clear at the time the call was dispatched. It was just maybe a disorderly person or something like that. And then an officer, if that's the case and there's a co-response car working, even though they didn't originally show up to it, oftentimes those officers will reach out and say, hey, can you come over here and assist with this call for service? So they come both dispatch from the 911 center and also, self-dispatched, if you will, from other officers.
Thank you. So one of the things is, an officer is going first, or maybe we can hear from DEC so that they can share the criteria that they're utilizing at some point. But so an officer is making that determination on the scene. Sometimes the officer's presence first. You can share this about the training with de-escalation, with how y'all are handling that. But often, if DEC hasn't made that call through their determination, then it is the officer on scene that is then making that determination. Is that right?
Yeah, I'm sorry. And let me be clear too. What I'm talking, where I thought you were going with your question was, how do we determine when a co-response car is going to be dispatched? So a call comes into the DEC, they're going to decide, is this, and I don't want to, I'll let them speak to that criteria, but if it's a police call for service, if it involves, it needs to be the police, not fire, for instance, because there's maybe a public safety issue there, then the co-response car is an officer riding with the clinician. And if that car is available, they're going to send that car. But sometimes what I was saying is sometimes, I maybe get dispatched to a call for service that it's not evident at the time the call came out that it involves someone who was in a mental health crisis. But I get there, I get on scene, and I determine this person probably needs some resources. They may be experiencing some issues. And I know my buddy's working in the co-response car. I can reach out to them and ask them to come to the scene and address the call.
All right. Thank you. And I'll probably follow up later with some more information on if we could spend more time on some best practices for determining mental health at the scene. And then at some point hearing from DEC would be really helpful. But my colleague may have another question for the current witness.
Thank you, Councilmember Gadd. Vice Chair Prep T, you are recognized.
Thank you, Mr. Chair, and thank you, Chief Gilder. I think this is an absolutely vital program. So my particular question, well, I have two main questions. The first one being, how many co-response cars are there per shift, if you have that available?
I don't have that handy, but I will get that to you very soon.
Okay, and are there any shifts or any days where we just don't have the resources to staff a co-response call?
So my understanding is that they are across all the shifts, but it's, there's not somebody 24 hours a day necessarily. And what I mean by that is we have some shift overlap. Officers work 10.5-hour shifts. And so you will have, starting from your days into late in the evening where they're starting from A shift, B shift into C shift, but they may not be there at like 3 in the morning or something like that. But again, those are not like, peak calls, hours for calls for service. And again, that's where I think it becomes important, the fact that we send all our officers through CIT training, just in the event that a car is not available.
Perfect, thank you. Because I know that when it comes to mental health crises, and especially those who might be living with all forms of Alzheimer's and dementia, that folks will tend to, there's a clinical term called sundowning whenever they're doing well normally throughout the day, but then later on in the evening, they start having health issues and becoming symptomatic of the disease that they're living with. So I think what I want to do is connect with you to make sure that we're allocating enough resources to make sure that across all shifts and across all times that we've got some availability, because that's a concern that I have that some of my constituents have raised with me. So definitely want to work with you to make sure that we're allocating the proper resources so that regardless of the time, folks here can have access to this.
Yes, sir. I'm happy to discuss that with you.
Thank you.
Thank you, Vice Chair Prep T. Councilmember Coopin, you're recognized.
My next question for the witness. Sorry, I always wanted to say that to a police officer. Thank you, Chair. Just wanted to just share my deep support for this program. It's been phenomenal. I've watched it in action on calls a number of times, and just to watch people that are in crisis have police engaged, but to have the first person that sits down with them be someone who's trained, who's from mental health co-op, who's providing that support. I mean, it's been a really spectacular thing to see, and there are calls that could have gone a different way that I've watched be de-escalated because of that. So just want to share my appreciation for y'all working with them and for them working with y'all, and it's just a really great program. Thanks.
Councilmember Porterfield, where are you on the board? You're recognized.
Thank you so much, Chair. I wanted to jump on the appreciation train here. It wasn't too many years ago when Councilwoman Toombs and I were really advocating for these types of services, and I just wanted to acknowledge the work of our community partners and NOAA in particular that were really pushing for mental health supports when people were in crisis. And just being very thankful for Chief Drake with moving forward with Partners in Care, being very thankful for Chief Swan for moving forward with REACH. This hasn't always been the case in Nashville, and we're just very thankful that we are now providing the services so that when people are in crisis, they're able to get the appropriate services. So this has been years in the making, so we're so thankful that the program is still going strong, that it's being successful, and that we're continuing to expand the good work that we're doing. So just want to say thank you.
Thank you, Councilmember Porterfield. Vice Chair Prep T, back to you.
Thank you, Mr. Vice Chair. Just a quick follow-up question for Chief Drake, or our former very able budget chair might be able to answer this. But is this program currently fully funded? And if not, what additional resources would we need for this program? For whomever would.
Yeah, I don't know if anybody from Mental Health Co-op is here. That would be probably a great question for them. That's a question that I'll note, Vice Chair, and then I'll follow up.
Thank you.
Councilmember Gadd, you're recognized.
Thank you so much, Chairman. In the consideration of time, if we could have DEC follow up with you regarding the question that I have, which is if they could share more information on the determinations from the 911 center on how they make those call determinations.
Yes, Councilmember, I've got that on my list. Thank you for the follow-up. Any other comments? Okay, we have a motion in front of us. All those in favor say aye. Opposed, no. Motion passes. Item number 6, RS 2025-1490, sponsors Toombs, Huffman, Bradford, and Welsh, a resolution approving a grant contract by and between Metropolitan Government, acting by and through the Metropolitan Board of Health and Pet Community Center for the provision of spay and neutering services. Do I have a motion? Do I have a second? All right, I pulled this one off of consent. I just had a brief question. I don't know if anybody from the Department of Health or from MAC is here that could field that. Not to put you on the spot.
I can try.
Just a brief question. So the spay and neutering is a massive need in the county. There's been requests from this council body for a mobile spay and neuter clinic through our work lists for the past few years. And my question really is just with this particular resolution, how much ground can we cover for this? Does this cover an afternoon session? Does this, what are we looking at in regards to this? Thank you.
I don't have a lot of information on this since it was a direct council appropriation, but I can get the information and get back to you.
Okay, great. Thank you. Councilmember Weiner, you're recognized.
Thank you. I don't know why everybody's looking at me and pointing at me. I completed the study of what was going on relative to operations over at MAC this past year. And one of the blaring pieces of information that I was able to uncover is as it relates to spay and neutering and many of the other services that we're supposed to be providing, they are woefully understaffed. And that's part of the issue. Funding is essential. If you go back to the report that I shared, you're going to see a laundry list of things that we need to do to support them. And more of that is going to be coming out pretty soon.
Thank you, Councilmember Weiner. Any further discussion on this item? All those in favor say aye. Opposed, no. Motion passes. All right, just one item left, and this is an ordinance item number 12, BL 2025-1011, sponsors Coupin, Toombs, Gamble, Huffman, and Horton. An ordinance approving 2 lease agreements between the Metropolitan Government of Nashville and Davidson County and P&H Properties LLC for the use of space located at 120 3rd Avenue North and 211 Commerce Street. Do I have a motion? Second? Do I have a second? Thank you. I see the primary sponsor. I will open it up to you, sir. Councilmember Coupin, you're recognized.
Thank you, Chair. And I'll give a little context on the bill and then would love for someone to move the amendment. It is a friendly amendment by Councilman Evan Siegel. But this creates a lease agreement for a park property in downtown. It's an area that both myself, who spends a lot of time downtown, and actually Councilman Evan Siegel, who used to work in that building, both would not have even called a park. It's a kind of patio-like area. The owner of the building is engaging in this lease and going to build a fire substation for us on that space. They're going to activate and program it. One of the challenges that we've seen in downtown green space and activation is the amount of programming it takes to kind of make those spaces come to life. So this to me is a win-win for everybody. I know there's been some concerns about net loss of park space. We're not giving it up. It's a 30-year lease. We're just leasing it to someone who's going to own, operate, and manage it and make it a better space. I know the fire department's really excited about their substation. So I hope my colleagues will support it and hope that somebody can move the amendment.
The amendment is moved and seconded. Let's see, all those in favor, aye. Opposed, no. All right, moving to the item as amended. Any discussion? Councilmember Welsh, you're recognized.
Thank you, Chair, for recognizing me, even though I am not on the committee. Mr. Ryder made some very good points if we are not actually following the rules that are in the charter when we enter into these leases. So that's something that gives me a little bit of pause. But a bigger thing that gives me pause is that there is actually no rent being paid, that the entirety of what we are being given for this is a fire station that we're estimating is about $2 million in value for a 30-year lease. It seems like we're kind of getting the short end of the stick there. So I think that that's just something that we should consider because that is valuable space downtown that perhaps could be used for other things. Thank you.
Thank you, Councilmember Welsh. Any other? Yep, Councilmember Coupin.
Thank you, Chair. And appreciate my colleague's question. I was wondering if someone from the Parks Department might be willing to come up and just kind of give some context. This also went through extensive park review, and I believe there's some information that would be helpful.
If you'll recognize yourself, sir.
Kevin Roten, Parks Department. Thank you, Mr. Chair. Thank you, Councilmember Coupin. Everybody, this is a 3/10 of an acre courtyard behind a large office building. It's the old Baker Donaldson building. If anybody knows where that's located, it's up those stairs on the top there. We do not own any of the air rights in this space. We do not own anything below the space. We own just the sliver of the top of the courtyard space. We were given this by MDHA back in 1998. We don't know how or why it got transferred to us. We have a feeling it was to pick up the trash in the back of the building. We don't know for sure. It's never been used. It's never been permitted. The majority of this space will continue to be open to the public. It will continue to be owned by parks. We will review what they are doing on the space every year. They have an annual review period. Like I said, utilities, maintenance, everything else is going to be done by P&H Properties. The only thing that they are putting on the top there, which they have the air rights, and below, down in the garage, they're doing the fire substation, and then they are doing a small gift shop over next to the building. So that we don't feel like we're losing anything because we're still maintaining the open area. Excuse me, the open area. It's still going to be open to the public, but Metro is gaining a fire department for the downtown area that we don't have. So, thank you.
Councilmember Welsh, you're recognized.
Thank you, Chair. If the bill's sponsor or someone could explain what Councilmember Evan Siegel's amendment is actually doing to this bill.
I'll recognize Tom Cross with legal here. One moment.
Because it is a fairly long lease, the main change had to do with including an escalator effectively in the insurance requirements.
Councilmember Porterfield, you're recognized.
Thank you, Chair. I'll speak to it a little more since we talked about it yesterday in budget. There was a concern if, and I'm going to try to paraphrase what Councilor Evans Siegel said, so my apologies if I don't get it exactly, the nail on the head exactly, but in essence, if there was like a fire or something that happens, we want to make sure that what they are paying, that the insurance, and Director Darby help me out here if I'm to make sure I'm getting this right, but to make sure that the insurance is covering for the duration of the lease. Like if something were to happen, we want to make sure that they are paying enough to cover it for the duration of the lease so that we're not stuck in a situation where we have had to, I guess, overpay. I don't think I got that exactly right, but it's similar to close to what Councilmember Evans Siegel said. I felt like that was a little legalese. I think it needed to be a little bit broken down a little bit more for council members and the viewing audience, respectfully.
Yeah, of course. Let me take another shot at it. So the original version of the lease had a fixed number for the amount of insurance coverage they needed to provide. And Council Member Evan Siegel correctly pointed out that that doesn't make sense for a lease as long as this, and that you need to be looking at your insurance coverages periodically. And so her amendment added a provision that requires the parties to evaluate whether the insurance coverage is adequate every 5 years and increase the limits if necessary. How about that?
Thank you. I approve.
Any further discussion? All those in favor as amended, say aye. Opposed, no. One no. Okay, got it marked. Okay, we got a little bit more business to take care of. That's all of our legislation items. Oh, yes, ma'am.
Point of order, was that not on the amendment? Don't we have to vote as amended? No, that was the whole thing?
We voted as amended, and then, yep.
Thank you.
Thank you for double checking me, though. Okay, so that's all the legislative items. We've got just a couple of additional items to address. The first is to select a member of this committee for the Metro Action Commission and then also for the Safety Advisory Board. We're going to start with the Metro Action Commission. Both of these, to be clear, are 2-year terms. Do I have any nominations for the Metro Action Commission? Councilmember Evans, you're recognized. Councilmember Porterfield, you're recognized.
I wanted to nominate Councilmember Brenda Gadd.
Councilmember Evans.
I'd like to nominate Councilmember Jeff Gregg.
Okay. Councilmember Gadd, go ahead. Yep.
I would like to withdraw my nomination.
Thank you. Y'all are really testing me to make sure I know where everybody is on the board here. I appreciate that. Okay, so we have one nomination. Any other nominations? Okay, well, without objection, the committee has selected Jeff Gregg to serve as the council representative for the Metro Action Commission. Congratulations, sir. All right, just one more item in regards to committees, and that is the Safety Advisory Board. Do I have any nominations? Councilmember Evans.
I'd like to nominate Commander Nash.
Anyone else? All right, without objection, the committee has selected Councilmember Bob Nash to serve as the council representative member of the Safety Advisory Board. Thank you, sir. Yep, Councilmember Nash, you're recognized.
I would like to thank everyone
I served for 2 years and the committee never met. And HR now has kind of decided to revitalize this committee. And so I appreciate the chance to participate in a committee that's actually going to meet and do some things maybe. Thank you.
Thank you, Councilmember Nash. I see a few departments back there. I don't know if anyone has any specific updates. Yep, OHS, yep, come on up.
Allison Cantway with the Office of Homeless Services. And we've got our deck going around, so everyone should get it. As y'all know, there are lots of data in this deck, but I would like to alert y'all to our report highlights for this month. I'm sorry, I still sound a little bit like a frog because I'm getting over a cold. Okay, so OHS hosted another informational session about the pallet shelters. So we held a session back in May, I believe, an informational session just to let folks in the community know this is what they are. Here are, the ideas for how they can be used, engage interest. As I'm sure all of y'all know, we did release an RFP and we got no responses to that RFP. So we wanted to hold another informational session, again, to answer any questions, engage if there is more interest. And we wanted to sort of see what the barriers were from folks applying for this. And so, I asked all the members that were there very specifically, what are the barriers for you? And they all said that none of them had the requisite land to place them on or funding for staff to operate them. We were hoping that maybe there was some, partnerships that could be formed, but ultimately none of them were able to hold up either end of the partnership. So we will reconvene our multi-departmental group that, composed the RFP to meet to discuss the next steps. Several community work groups have been happening on interim strategies to address homelessness. So there have been, a handful that have already taken place and a handful that are coming up, but we wanted to update you. This work is ongoing, but right now they're on a phase of giving surveys to folks who are experiencing homelessness or have experienced homelessness to ask what sort of interim strategies they would be interested in and some other things just to kind of get a good sense of what the community is asking for. Preliminarily, so far, the surveys they've received, it seems like folks are most interested in converted motel or hotel rooms and in tiny homes. Those are the two areas that have gotten the most votes so far. Of course, we'll update you as this continues. Okay, Scobey House, which is Nashville's first publicly funded permanent supportive housing project, had an event hosted by their operator, DePaul USA, to celebrate their 1-year anniversary, and that took place on August 21st. DePaul is a 90-bed, Scobey is a 90-bed facility that is operated by DePaul USA. In the past year, they have served over 100 folks coming from homelessness, with about 2/3 of them having experienced chronic homelessness prior. So there were lots and lots of residents that were there, really to celebrate the work that's been done in the last year. We've had residents that have gotten jobs. We've had residents that got connected to physical health care, mental health care. We had a resident graduate from college. I mean, really, really exciting stuff. So that was a great thing. There were lots of partners there. I believe that there were many council members there as well, and the mayor did speak. Okay. And I did want to say we're just really glad that council was able to move forward on the funding resolution for DePaul, particularly now that we're right at the 1-year mark. They've done some pretty incredible services, and the folks that live there have accomplished some really incredible things. Obviously, that situation has not been without its challenges, as to be expected in any residential program in its first year. But, the challenges have been things that are not particularly uncommon in this sort of project. And we've been able to move forward with accountability while, maintaining the privacy and the confidentiality of those clients, getting the services that they need. Okay, OHS is sponsoring a 5K on October 3rd to support Metro Makes a Difference. So it is open to the public. It is a $25 recommended fee. Folks with lived experience may sign up and they do not have to pay the fee. But it will take place at Ravenwood Park over near our office in Donaldson. We encourage everyone to sign up. So if there are any runners in the room here or here, please consider signing up because obviously we know that Metro Makes a Difference is a really great cause. And then lastly, we wanted to give some data just to sort of show the larger context of homelessness. Our office has been in existence since 2023, so just a little over 2 years. So we wanted to show some data over that time period. Now, I will say there are not national numbers available for 2025 yet, obviously, because it's ongoing. So the point in time count, which happened earlier this year, the national data are still not prepared yet. HUD is working on that. So just with that caveat, but between the last 2 years for which there was data, 2023 and 2024, unfortunately, nationwide homelessness increased by 18%, which is pretty staggering. The peer cities that I know that council often sort of looks to sort of compare progress on any number of fronts, have mostly experienced large increases in homelessness between that 2023 and 2025 mark. And we have a chart right here where you can see, Austin, which has done really incredible work, and they've housed a lot of people in permanent supportive housing. I think their outflow, they have a good plan for that, but the inflow has been such that homelessness increased there by 36%. In Raleigh, they saw an increase of 18%. Louisville saw an increase of 14%. Denver increased by 10%. And in that time period, Nashville increased by 2.4%. So of course, in addition to all of the data in here, we wanted to kind of zoom out and give you a sense of kind of where things are situated right now.
Thank you, Allison. Any questions for Allison? Yep. Councilmember Porterfield.
Thank you so very much. If any nonprofits or organizations are interested in the pods, how should they go about moving forward?
Yeah, they can absolutely reach out to me. They can email me or they can call our office. Anyone who is interested, we would love to hear from them. I think what we've heard from the community is that there's a lot of excitement about the pallet shelters. There are a lot of folks that would love to support the work. But it's just the land and the staffing are just real two sticking points.
I know Councilmember Evans has been working on that subject. I don't know if you have anything that you wanted to add to that.
Yeah, I only wanted to add that the news coverage did spur some interest from random people, and I have given them your email address.
Great.
So that way they could contact you. And I did hear from one person that is probably the most promising related to like a land conversation. But I'm going to talk to him first before I send you anything about that. But thank you for your work on that and the continued, progress, and also to the news for wanting to talk about this every 6 months, because it has helped, I think, kind of remind people that they're there, so that way we could generate some more interest.
And thank you for all your work on it too, Councilmember. We really appreciate it.
Thank you, Councilmember Evans. Thanks, Allison. I just had two quick things I wanted to comment on. One was a statement that was made on a network that I'm not going to mention, by a name that I'm not going to mention, but it had to do with our unhoused population, and that we should euthanize those who have mental health issues that are unhoused. That's not how we handle it in Nashville. I want to reassure our residents, we treat the problem here. The Office of Homeless Services, in partnership with the Metropolitan Police Department, with the Mental Health Cooperative, and many other agencies, do the Lord's work when it comes to helping the most vulnerable populations. I know that individual has taken that back, but unfortunately, we live in a world where the damage is done long before that is taken back. So that is not the position of this city. That is not how we handle our business. We treat the problem of homelessness by treating the problem. So I just wanted to make that clear. And lastly, just to comment as well, we saw a heavy increase in the number of calls that came into our non-emergency line in Nashville through DEC on Friday afternoon due to the amplification from someone who will go unnamed. I just would like to make a plea to the public. Just when you call in thinking that you're going to yell at someone at the Department of Emergency Communications, just think that about the amount of calls that you're potentially preventing from coming through. That is something that you just need to be mindful of. We need to make sure that our citizens have direct access to the care that they need. So just wanted to make that quick comment. And with that, that's all that I have. And do I have a motion to adjourn? We're adjourned. Thank you.